From the Benson Tower Studio, this is Fox 8 Morning Edition at 6 a.m.
Learning how to read food labels is a key step in learning how to eat healthy. But if you're looking at the labels and it leaves you a little confused, Dr. Meredith Maxwell joining us now to show us what to do. I never know what I'm looking at when I'm looking at the labels. And Jerry was saying we need a magnifying glass to see it first of all.
It can be very, very confusing. Food labels provide a lot of information if you know how to read it. And it's kind of complicated if you've never been taught how, and I don't think a lot of people have been.
No, you think you see the calories. Okay, this is less than 100. This might be good. But what should we be looking for?
You have to look at serving size. They want to make you think it's healthy. So, one serving size could be tiny, tiny, tiny. So you really have to look at how many are in each label, and then you calculate, okay, well, if that's half a cracker, I mean, that's not worth it, right?
Right.
So you really have to look at that and calculate for yourself, bring a calculator maybe, to figure out what they really mean. There's things on there called PDV, percent daily value, which shows a percentage that a normal person's supposed to get each day on the side of each ingredient, so like fat, calories, cholesterol, sodium, those kinds of things.
So when we see the vitamins listed in PDV, and they have a 20%, that's 20% of what you're allowed for each day.
Correct. Supposed to, based on a 2,000 calorie diet. Some people are special, depending on what kind of medical problems you might have. So it's not for everybody. This is just for most people.
This is the average person. And for a man and a woman, it's a little different, right?
Definitely.
What is the calorie, I guess, max or daily average for a man versus a woman?
Well, it depends on your activity level. So if you're, if you don't do anything, it's going to be a lot lower than if you're like an active person. So it really depends on your height, your weight, and your age for each calorie level.
Because I've heard 2,000 for men, 1,500 for women. Is that kind of like an average?
It is, and it just depends on, like I said, activity and how many calories you take in and what you need. Are you the right weight? Are you the wrong weight? So everything needs to be for you.
And to keep it in moderation.
Oh, definitely, definitely.
What about nutrients? Should nutrients be listed? Are they always listed on the labels?
They are not always listed. Vitamin A, calcium, iron, those are some things that are listed. You would have to actually read the ingredients for more, and a lot of those ingredients are super long words that nobody understands. So you know that probably those aren't natural ingredients. That
so
gives you a
not listed, and you have to go in the fine print at the bottom.
Right.
They're not natural. What about low fat versus reduced fat? What's the difference there?
So low fat is less than 3 grams of fat per serving. Reduced fat is about 1/4 compared to a regular product. So and light is about 50% reduced fat. So low fat, then reduced fat, then light. And light is the least fat that there is.
Okay, so that's probably the best one.
Right, so reduced is 1/4 and light is 50%. That's how I like to think about it.
See, I see that on different labels. Like I always get the Triscuits, for example, because they say that's better than chips. And I get the reduced fat.
Right.
But I'm like, is it really that light?
Well, compare it to the regular box, because if they take something out, they had to put something in. So you might be getting something else besides fat, like calories or sodium in the reduced fat. So you always want to make sure that for you, it depends on what you want in your diet.
So as far as the grading of it, light is the best, then it's reduced?
Right, well, fat-wise.
Fat-wise,
right,
yeah.
Right.
Okay, and as far as organic or natural on a food label?
Natural is not really FDA regulated.
It's not?
No, you can still have injected salt into it. You can still have cornstarch put into it, because corn can be natural. Just not artificial flavorings or colors. Organic has more stringent regulations, like no bad fertilizers, no irradiation, no growth hormone. So that is actually regulated. So natural is kind of an iffy thing.
So organic might be best to stick with the organic versus the natural if you're shopping.
It could be, but organic doesn't mean healthy. You can still have unhealthy organic food. It's just the way it's made is the difference.
I think people hear that, they think, oh, fancy, organic, this is better for me.
Right.
You really got to have almost like a dictionary.
Exactly.
And be ready to go in the grocery store before you hit the aisles.
Exactly.
To
it's unfortunate, right.
Because unless you're a dietitian or a doctor, you really don't know. Well, these are some great tips. I feel like I've learned a little bit today. Thank you so much, Dr. Meredith Maxwell, for joining us this morning with those nutrition label tips.
Of course.